Although depression can happen in anyone, it's worth singling out teen depression because of how often it is ignored, because it's seen as a sign of just being moody or typical of a teenager. And although it can happen at any time of life, symptoms may be different between adults and teens. It can cause emotional, mental, and even physical problems. Of course, the pressures of teenage life bring a lot of highs and lows, but for some people, the lows are more than lows. They're a sign of depression. So today, we'll go over 3 major components of teenage depression, how they might manifest themselves, and when to know if treatment is needed. The first sign we'll talk about is feelings of sadness, and specifically, random bursts of crying for no apparent reason, as in nothing triggered the random bout of sadness. This can be a sign that a teen's body is having difficulty regulating key emotions physically, which is a major sign of depression. These bursts are different from more lasting thoughts of sadness that are also a problem. They are acute and powerful, which is why emotional outburst can be a symptom of a teen suffering from depression. These outbursts can also include frustration and anger over tiny things. Remember, it's not just sadness the body is having trouble with, it's the regulation of all emotions. The second sign to talk about is the long-term emotional changes in teens suffering from depression. Some examples are feelings of hopelessness or emptiness, long-term irritability or annoyance, lost pleasure in usual activities, unusual new conflict with family and friends, unfounded feelings of guilt, exaggerated self-blame, and fixation of past failures. Difficulty concentrating or remembering things and a sense that the future is grim or bleak are also signs of teenage depression. Although these are less acutely powerful than the emotional outbreaks we talked about earlier, they can still have a huge impact all on their own. They can cause significant distress at school or home, socially, or at work. These feelings can range in severity from person to person, but a teenager suffering from depression is likely to express at least one of these symptoms. The third and last component of teenage depression is behavioral changes. These can include fatigue, abnormal sleeping patterns such as insomnia or sleeping too much, which can have spillover effects in all areas of teenage life. A lack of sleep especially can make the emotional symptoms of depression seem much worse. Another behavioral sign of teenage depression is changes in appetite, including weight loss or cravings for food and subsequent weight gain. A teen suffering from depression might also display agitation or restlessness, including hand-wringing or an inability to sit still for any period of time. They might also complain about frequent body aches, isolate themselves socially, or pay less attention to personal hygiene. Of course, 2 of the most serious signs of depression can also be present: self-harm and talking about or even attempting suicide. These are all examples of behavior a person experiencing depression in their teenage years might display. Of course, with teens it can be especially hard to tell what's normal and what isn't. The best way to figure out for sure is communication. If you think your teenager is depressed, talk to them. Try to see if they're capable of managing emotions, challenging or not, or if life seems overwhelming. Although it can be difficult, there are some clear signs they may need professional help. One is that the symptoms of depression may begin to interfere with daily life. Another is having serious concerns about their health and safety. Most of the time, depression symptoms don't get better on their own, and they may even become worse over time. For this reason, it can be extremely important to seek professional intervention when necessary. If you're worried about your teen's depression, reach out to a trusted professional like a healthcare provider to get started. These 3 components, emotional outbursts, long-term emotional complications, and behavioral changes, are the major components of teenage depression. If you found this video at all valuable, please remember to like and subscribe, and comment down below what you'd like to hear about next.